Haemophilus. Haemophilus. Here's an introduction for Haemophilus. These are short, non-motile, gram-negative rods. Oftentimes, they're actually referred to as a coccobacillus. So it's not a true cocci. It's just like it's stretched a little bit. So it's a really short rod. So that's where the term coccobacillus comes from. They're typically found in pairs in short chains. They don't actually gram stain very well, so sometimes you really have to go and put in the extra effort to find them in a gram stain. Haemophilus are associated with mucous membranes of the respiratory and genital tract. They are facultative anaerobes, although they prefer aerobic. The name itself means that they are blood-loving, and they are susceptible to drying and temperature extremes, just like the Neisseриas are. Haemophilus species typically require 1 or 2 growth factors, which is found in fresh blood for energy production. So heme, which is factor X, that's heat stable, and is needed for synthesis of the cytochrome system. In the NAD, the nicotinamide adenine dinucleotide, or factor V, is the heat labile form. All species reduce nitrates, and they ferment carbohydrates. Haemophilus are transmitted either by respiratory route or through sexual activity. Your most important Haemophilus is Haemophilus influenza group B or type B polysaccharide capsule. Group B Haemophilus is a leading cause of bacterial meningitis in children 5 months to 5 years of age. So there's actually a vaccine for this, and it's called the Haemophilus influenza B vaccine. So again, meningitis in children 5 months to 5 years, if not vaccinated for Haemophilus influenza, also can cause respiratory tract infections. In the biotype Aegyptius, can cause acute conjunctivitis, so drainage from the eye that would need to be swabbed and cultured. And Haemophilus ducreyi can cause cankers or ulcers in the groin area. So more specifically, Haemophilus influenzae is once again a small gram-negative coccobacillus, and it's very faint staining usually. The type B polysaccharide capsule results in the organism being antiphagocytic. However, you can have non-encapsulated strains that are normal flora of the upper respiratory tract. So if you look at the picture on the slide, you can see the organism, and then you can see like a faint ring around it, and that is actually the polysaccharide capsule around the organism. So Haemophilus influenza can cause respiratory tract infections as well as female genital tract infections and neonatal sepsis. Haemophilus influenza is acquired after inhalation of contaminated respiratory droplets. It can cause otitis media and acute sinusitis. In children less than 2, we can also see this as a causative agent of septic arthritis and cellulitis. Also obstructive epiglottitis and pneumonia in children and the elderly, and especially the elderly that have coronary obstructive pulmonary disease. Haemophilus influenza may cross the blood-brain barrier, which causes meningitis, which is most common in 6 months to 1 year of age. We do have a vaccine for influenza type B. This is the conjugated vaccine that contains that type B polysaccharide, which is coupled to a carrier protein. The immunization standard has been in place since the 1990s. Again, the Haemophilus influenza biotype Aegyptiacus causes a purulent conjunctivitis, sometimes referred to as pink eye, and can also be responsible for severe form known as Brazilian purpuric fever. So your specimens are going to include nasopharyngeal swabs, blood, cerebrospinal fluid, pleural fluid, sputum, and exudate specimens from the throat, not obtained if epiglottitis is present. Therefore, you'll generally do a blood culture for those. Because if it has epiglottitis, it could be contaminated with the normal flora of the mouth. So we will isolate on chocolate agar, and what we're looking for is growth for X and V factors. Haemophilus will not grow on a blood agar plate. V factor is available from Staph aureus and yeast, so sometimes we'll see satellitism, and we'll talk about that in a little bit. So the plates are going to be incubated at 10% CO2. So again, another capnophilic loving organism. The presumptive identification, if the organism requires both X and V factors, you can presumptively identify that it is Haemophilus influenza. On that satellitism, if you take a suspected organism to do a blood agar plate by striking with Staph aureus on the plate already streaked with the isolate. So if you think you maybe have Haemophilus, you're going to streak with the Haemophilus, and then you're going to do a Staph aureus streak down through the center. So Staph will actually lyse those red cells, which will provide the X and V factor. And that is when Haemophilus influenzae will grow close to that Staph streak, and that's what we call or consider satellitism. Haemophilus influenzae can use a porphyrin test, and this is used to determine if Haemophilus produces porphyrins, which is the precursor of heme. A negative porphyrin test indicates the organism does not produce porphyrins, therefore it requires X factor or heme from the environment for growth. This helps differentiate species that require X factor from those that do not. So the Haemophilus species require growth factors X or heme and or V for growth. Some species can synthesize porphyrins internally, allowing them to grow without external X factor because they can convert porphyrins into heme. For the test principle, so this detects the presence of porphyrin compounds in the bacterial cells by fluorescence under UV light or by chemical reactions. A positive result means the bacteria produce porphyrins and do not require X factor from the environment. A negative result means bacteria do not produce porphyrins and thus require external X factor for growth. For clinical relevance, so you have Haemophilus influenzae, especially type B, is porphyrin negative, so it does require X factor to grow. This can help differentiate Haemophilus influenzae from other Haemophilus species like Haemophilus parainfluenzae, which are porphyrin positive and can grow without added X factor. For Haemophilus influenza isolates, we always need to be able to perform the beta-lactamase testing. Ceftriaxone is now your drug of choice, which replaces ampicillin for treating meningitis. Respiratory tract infections can be treated with ampicillin, chloramphenicol, or a sulfa drug. Rifampin can sometimes be given as a prophylactic if needed. And eye infections can be treated with a topical sulfonamide or tetracycline. Haemophilus parainfluenzae is a normal flora of the respiratory tract, and it does not require X factor or heme for growth. Haemophilus ducreyi is endemic in warm tropical regions. This causes the chancroid genital ulcers in the groin area. Haemophilus ducreyi is never normal flora. It's always sexually transmitted. It will be a gram-negative coccobacillus on gram stain. A lot of times it's going to be referred to as an appearance of a school of fish. So if you look at the picture on the slide, it kind of looks like schools of fish kind of floating around, in between the white cells on the picture. It could take up to 7 days of incubation for this organism to actually grow for us to recover it. And the treatment for this is erythromycin. We have a couple other species of Haemophilus. So we have Haemophilus hemolyticus and Haemophilus parahemolyticus. These result in a strong beta hemolysis, and they also produce the urease enzymes. And these species are normal flora of the nasopharynx. At-risk individuals would be people who have had a splenectomy or have a non-functional spleen. It can also cause pneumonia in the elderly and the immunocompromised patients.